A very warm welcome to another episode of Today's Parent, where we connect you with experts and provide you with information to make your parenting journey a bit more easier. I'm your host, Christine Casina. In today's episode, we are talking about diabetes in children. It's something that we don't often talk about, and in studio today we have a nutritionist, Betty Okere, who's going to enlighten us on matters diabetes in children. Betty.
Asante sana.
Good to have you again.
My pleasure always.
Really nice to have you.
Yes.
Diabetes in children. Even before we get to, diabetes, let's just define what is diabetes.
So when you're talking about diabetes, we're talking about a condition in which your body is not able to use food. In other words, it is not able to use the product that comes out of you digesting food, which usually is when you digest your carbohydrates, you get glucose, right? And that is fuel for the body. But when your body is unable to use it because of one reason or another, then you end up in a state that is called diabetes. So it's basically a disease condition.
Okay.
And what would make your body not be able to use glucose? Because we all know glucose is energy or fuel for our body. We have a pancreas, which is an organ just behind your stomach.
I remember from biology.
From biology?
In high school, primary school?
I think it was high school. So behind your stomach, there's an organ which is called the pancreas, which produces insulin. Yeah, it has got cells that produce insulin. Now, this insulin is what acts as a key to be able to open your cells. So after you've eaten and the digestion process is completed, you have glucose. There's supposed to be an opening of your cells, for lack of a better word, so that all the sugar can then move in and you have some energy. Think about it this way: when you're very hungry, you haven't eaten, and then you get a sip of a sweet energy energizes you. So that sugar needs to be pushed into your cells to give you energy. So when that doesn't happen, then you end up with a problem, and that is diabetes. So what normally would happen, either you have very little insulin, you're producing very little insulin, or even the little that you're producing has got what we call insulin resistance. It's not being used properly. And this normally you will see in a type of diabetes called type 2 diabetes.
So we have type 2 diabetes. I know we'll get into the different types of diabetes.
Yes.
Okay.
Yeah, but when we are talking about diabetes in children, because again our topic today is diabetes in children, then they simply do not have insulin. They do not produce insulin.
How is that even possible?
Because then their pancreas stops working. How does the pancreas stop working? In children, diabetes is something we call autoimmune reaction. Autoimmune meaning it's just the immune system fighting itself, the body trying to fight itself.
Right.
How that really happens, nobody knows. We do not know the exact cause of type 1 diabetes. We do not know the exact reason why there is an autoimmune reaction. But then it is thought that maybe somebody was sick, a child was sick because of a certain disease, and their body produces antibodies to fight that disease that was there. But there is excess production of those antibodies. So after this child has gotten healed, there is a lot of antibodies hanging around. It's like, having your law enforcers beat up hawkers, and then the hawkers have disappeared, and the rest of us on the streets, they still have to work. So they'll beat the rest of us.
Right.
So that's what the extra antibodies are doing, and they may damage your cells, like the pancreatic cells, and then the child now ends up not being able to produce insulin. So in type 1, we are talking about absolute lack of insulin. But in type 2 diabetes, they have insufficient insulin, or they have insulin resistance, or they have both insulin resistance and insufficient insulin.
Okay.
Now, a third type, which is also now very common, is the gestational diabetes. And basically, in layman's language, it is diabetes that is diagnosed in pregnancy. The only challenge is we are never very sure at pregnancy whether it is simply gestational diabetes or it is a type 2 diabetes that was not picked in time.
Right.
So then it is the hormones that keep the pregnancy going that have pushed the body for us to be able to see the diabetes.
So the gestational affects both the mother and the child? Or?
No, basically it is affecting the mother. Because it is the mother who has gestational diabetes.
Right.
Yeah. And it's only for women because of the
of
gestation.
Course. Right.
So then if it disappears, after delivery, and we do the test which help us to diagnose diabetes, and we cannot see your blood sugar going up, you're just in normal ranges, we test your 3 months average blood sugar, and you're in normal ranges, then we know that was a true gestational diabetes, all right? But if it persists long after the delivery, then we want to ask ourselves, was this type 2 diabetes that we never picked in time?
I hear you.
Or it was triggered by the strain caused by the pregnancy hormones.
Okay.
And then we picked it.
Right.
Yes.
Betty, let's talk about the signs of diabetes in children. There could be a parent watching right now, and they're thinking top of their mind, this child of mine drinks a lot of water. And most of us, know that one common sign of diabetes is you're frequently thirsty.
Yes.
So just to put it into perspective, what are the signs of diabetes in children? And when a child is having water, when do you then tell, this is too much water this child is taking, probably I need to have them checked out?
All right, so, well, whether it is in children or it is in adults, there are some classical symptoms and signs of diabetes. And like what you're mentioning, excessive thirst. So there is thirst. You will feel thirsty and you will want water. But there's compulsive thirst. You really want water here and now, and a lot of it continuously. Now, that's a sign for worry. And then what you will notice that the frequent thirst or the feeling of thirst will be accompanied by frequent urination. Now, what most people think, it is because you're drinking the water, that's why you want the child wants to urinate. Yes and no. Because when there is excess blood sugar, blood glucose in the body, and it's like what we learned in biology again, osmosis. It is moving from a highly concentrated area to a lowly concentrated area. So water is trying to, move out of the cell, and the cells are yearning for water because they are dehydrated. Right? So then this child goes to pee, but the pee is not a lot commensurate to the amount of water that they're taking. Right? So they're taking in a lot of water, but only very little pee is coming out. And it is very frequent. Maybe a child who had stopped urinating on the bed, all of a sudden they want a lot of water and they're peeing on the bed.
Right.
Before you beat them up or call them names, you probably just want to find out what it is.
Get them checked out.
And then there is what they call polyphagia, excessive feeling of wanting to eat.
Polyphagia.
Yes, they just want to eat here and now, everything and anything. They seem to be very thin, but they want to eat. So you're wondering, they're constantly hungry. And I've just given you a lot of food. Why are you still asking for more food? And when you look at the food that they're asking for, they will not be asking for your typical meat or vegetables. They'll be asking for something that is loaded in carbohydrates, something that will give them instant sugar. A child will probably be asking for sweet drinks. They want more soda, they want more juice, more milk. Something that has got some carbohydrate in it so that they can satisfy that.
Okay.
Why is this happening? Remember, the sugar is high, but it is in the bloodstream. The cells which should be having this sugar are not getting it because we don't have the keys to open the cells to let the glucose in. Now, in children, what will now be different is when this happens over time and we have this excessive sugar rise, what we call chronic hyperglycemia, they might fall into something called diabetes ketoacidosis. You smell their mouth and it smells like, very ripe, almost rotten fruits. Some children might have what we call Kussmaul breathing. They're gasping for breath, and it feels like, they have something wrong with their lungs. It isn't. There is a lot of confusion. There are also children who will have complain of stomach aches, very painful stomach aches, but there's no diarrhea. Or some might have diarrhea or excessive vomiting, signs that look like they have malaria or typhoid. But when you take them to hospital,
none of those.
You're not seeing malaria, you're
typhoid.
not seeing infection, you're not seeing typhoid, but they're losing weight. There's also extreme sudden weight loss. It's 1 week, the child has lost 5 to 10 kilograms.
And they've been constantly eating.
Yes, and they've been constantly. So it's not adding up. Why are you eating and then you're losing weight? All right?
Yeah.
So those are just some of the symptoms. Remember, not all of them have to appear in a child. So when you start noticing anything unusual, frequent urination, frequent thirst, excessive thirst,
excessive
a feeling
eating.
of wanting to eat too much, they're losing weight suddenly, just walk into the next hospital facility and just check. Or if you have a blood sugar machine at home, it wouldn't hurt to just check and see what it is.
Right.
Yes.
All right, let's talk about the effects of diabetes on children. How does it affect our children?
So one, there's the social aspect, and of course there's the medical aspect.
Let's start with the medical.
So if we are doing the medical aspect of it, any child who has got diabetes, if we do not get the control of their blood sugar, then they can still also end up having any complication of diabetes. Remember, because diabetes in children or type 1 diabetes is very acute, we pick it or we diagnose it very fast. We normally will get the child before they have any complication. So their eyes will be functioning very well, their kidneys will be functioning very well, the heart, they don't have high blood pressure, no issues with cholesterol. But then, if this is not taken care of, they can still end up having these complications, just like the adults would have. Only that now the adults will come to hospital because all of a sudden they can't read their Bible from a certain level, or they have these dizzy spells and, blurry eyesight, or now all of a sudden their pressure has gone up. So for the children, they don't have that. But if they don't control the blood sugars, then that is a problem.
Right.
So that's on the hyperglycemia side, the high blood sugar side.
Okay.
But if you're talking about what would be the effect of this blood sugar on the child, there is the aspect of when they have low blood sugar, what happens? Okay? Yeah?
Right.
And low blood sugar is sugar we are considering to be between 4 millimoles, basically lower than 4 millimoles.
Okay.
Yeah? So this child, they might be feeling shaky, they have palpitations,
right,
confusion and anxiety. They're extremely hungry again, all right? There could be some blurry eyesight. And then, if it is not taken care of, if you do not treat that low blood sugar, the child can actually end up fainting or falling into a coma. Now, both the high sugar, hyperglycemia, the extreme of the high sugar, and extreme of the low sugar, which is hypoglycemia, are both not good. Because the more a child or any other person who has diabetes keeps on getting the low blood sugars, then even their heart is at risk. Yeah? So they say you affect the heart more by getting low blood sugars. So it's a very tricky balance. It's a balance that needs the whole society and everybody around the child to be concerned about it, so that you're not having your child with diabetes and then they're put in a corner. You have diabetes, you're going to eat brown things,
yeah,
and you're going to eat boiled things. I don't know where that came from. You're going to eat boiled things. And then the rest of the children in the house are allowed to have sugar,
and all the nice
chocolates, things. They can drink as much yogurt as they want, ice cream. So it's not that. It needs all of us. It's the doctor, the parents, and everybody, the school, Because again, if the school don't know, what happens to my child? Am I okay as a parent if my child is in school and their sugar is low? Or
yeah,
their
you have
sugar
to
is
inform
high.
the school.
Yeah, so the school also has to know.
It's important for you to do that.
Yes.
Let's touch on, before we go on the break, let's touch on the social part of the effects of diabetes on children.
So when we look at the social aspect of it, we're talking about a child having to test their blood sugar several times a day, 6 to even 8 times a day. That alone can be stigmatized, especially if the environment that the child is in
I can imagine.
does not understand. Or let's say you have a nanny who thinks your child is weird because they have to poke themselves. Or do you even have, because then when you're selecting the nanny, you have to know who to get. You can't just get anyone. And then there is the aspect of, remember, they're not producing insulin. So where do they get their supply from? They always have to inject it. So from diagnosis till death do them part,
which is something they have to manage for a lifetime.
They have to inject every single day because they can't use anything else. So imagine you could be mistaken for somebody who's taking drugs, if people don't know. If it's a teenager, for example, it's a boy, they have this young girl they're looking at and they're injecting. You looked at us as if you're being the only sickling.
Yep.
Yeah. Or if then you are having trouble with the sugars, low sugars, and you want to eat, it's in the middle of the class, what happens? How do people take you? All right? Do they say, oh, so-and-so likes eating so much? Do the other children make fun of you? So it's a lot of, social and economical and even medical aspects. You're talking about a mother who, well, we can basically just afford 1 million a day. What happens to my child? They're injecting insulin, they have to eat. All right? What happens if I have injected insulin and then I don't have enough? We are a family of 5 and we have to share this meal. So there are a lot of challenges that a child with diabetes would go through. But hopefully we are able to, sort some of this, even if not everything.
That's important.
Yes.
Before we go on the break, I am just curious. Are we then saying that diabetes is totally untreatable? We just have to find a way to manage it?
Type 1 diabetes cannot be cured and
So
cannot
type
even
1
be
cannot
reversed.
be cured.
Cannot even be reversed. If you can remember when I started, I said gestational diabetes can actually, after delivery can disappear, and we know that was a gestational diabetes. And then the other type of diabetes which I didn't talk about is diabetes due to other causes. Sometimes you have a sickness. Sometimes you have a sickness which might affect your pancreas, or maybe even for people who have pancreatic cancer. That's the same organ that's supposed to give us insulin. You might end up not being diabetic in the process. Or maybe you are in an accident that injured your pancreas, you'll end up being diabetic.
That's good to know.
Or you simply decide to drink your pancreas to death, alcohol, excessive consumption of
I
alcohol.
thought it affects only our liver. It affects,
It affects
our pancreas
most
as well.
of our organs, and the pancreas could be another one. Yeah?
Interesting.
Because then, it is overproducing your insulin to try and take care of the excess sugar that you're taking. Yeah?
Okay.
And that might just make it not function the way it's supposed to function.
All right.
So depending on what it is really, it's still just diabetes. So if it is type 2 diabetes, for example, now we are talking about remission. There are studies which are showing that you can actually manage the sugar so well to the extent you be able to reverse it or get into remission with type 2 diabetes. But remember, for type 1, they don't have a functioning organ. Their pancreas, which is supposed to function, is not working. So for that one, really, there is even no remission. And for all types of diabetes, there's no cure. So there's cure and there's remission, very loosely used terms. But for type 1 diabetes, there is no cure. So again, whether it is religious, let's go and pray for this child, and they're going to get healed, stop all the insulin, this is just the devil doing it. No. Please just make sure they have their insulin. Because in the absence of that, they fall into diabetes ketoacidosis, and they will fall into a coma and die. Yeah, it's life-threatening. If you have diabetes ketoacidosis, you find yourself in the ward.
Betty, we are going to take a short break, and when we come back from the break, you are going to share with our parents more information on matters diabetes in children, especially managing diabetes in our children.
Yeah, sure.
And with that, we are going to take a short break, and when we come back, Betty is then going to share how we can manage diabetes in children. Don't go anywhere. Welcome back to today's episode of Today's Parent, where we are talking about diabetes in children, how we can diagnose and how we can know the signs and empower ourselves better. In studio today, I have Betty Okere, a nutritionist, who's sharing all the information when it comes to diabetes in children. Betty, we are back from the break.
Yes.
And as we're settling in, we have a question that has come in from Martin. Mm-hmm. And Martin's question is, can my child get diabetes from eating too much sugar?
You see, there's always a lot of myths around, what really causes diabetes. Remember, we said type 1 diabetes is an autoimmune condition. We really do not have a certain cause why we have type 1 diabetes. So eating a lot of sweets will not make a child have diabetes, but of course, it's not good for their teeth.
Absolutely.
So they're going to have cavities
Absolutely.
and all that. It's not good for their weight, because then you have extra calories that you're not using.
Then you have to deal with obesity.
Exactly, you have to deal with obesity later. And even in adults, let's say people who have type 2 diabetes, by eating a lot of sugar, eating a lot of ice creams, that directly will not cause you diabetes.
Interesting.
Otherwise, all of us would have diabetes. But eating that, because it is extra calories, you're going to gain weight, you're going to have obesity, and that insulin resistance due to obesity might be a risk factor for diabetes. But
Right.
directly, there is really no correlation. And you see, this myth is what makes it difficult for parents and even people with diabetes to manage their condition. Somebody will tell you, you know what, you're diabetic, you only have to eat brown ugali. What happens to me if I was born and brought up eating mokimo? What happens to me?
Yeah.
Do I drop that mokimo and start eating, my brown ugali? Taste and preferences, what is available, what is affordable, what is acceptable to the patient, what is acceptable to this child that has diabetes. Remember, this is a child who needs to grow. Over and above everything, we want them to grow like any other normal child. We do not want your child having stunted growth, because now all of a sudden you're diabetic, you cannot have fried
or you
food,
can't have,
or you can't eat meat. It's all meat. And really, my advice to the parents would be, work with your experts. Work with your experts. Everybody has a point, or they mean well. They're trying to help you, because I know my grandmother used to have diabetes. Yeah, but
this
is
what
my
they
child.
did.
Yeah, that was your grandmother. This is my child.
So it's better to seek expert information.
Seek expert information. If you're going to see a diabetologist, or see a child endocrinologist, a pediatric endocrinologist for your child's diabetes condition, because diabetes is actually an endocrine issue, right? Get the right specialist. Don't just walk to anyone, any general doctor, clinician, seeing your child. They don't even know what they're doing.
For sure.
And of course, you're going to work with your nutritionist. I like the way nutritionists are left at the end of the tail of everything. And then when we have to perform miracle, everybody just shows up.
That you need to see a nutritionist now.
Exactly. So just work with a nutritionist along. Help them help your child, or even you as a parent, find out how else would you make this child fit into the normal family routine and normal eating. Let's say your child is 2 years old and they have diabetes.
Wow.
And then you decide you're going to give them brown foods. What is the probability that they're going to eat it? They're not going to eat it.
No, they're not
and it's
going
going to frustrate them. Or then you tell them you're not going to eat cake.
Anymore.
And it is their birthday. Trust me, they will sneak and they will go and eat that cake. So it is us to know, as we're helping this child to learn, they had cake today, it was their birthday. They have insulin. How much more insulin do I need to give this child? Yes.
Betty, I have a question for you.
Yes.
What's the lowest age or the youngest case of diabetes you've seen in a child?
I've actually seen a premature in the incubator with diabetes. But it could have been a case of transient diabetes.
What, from the gestational aspect?
Not really.
Or?
Like after they were delivered, maybe it was an issue of sepsis or what we call...
okay.
I'm trying to look for the easiest way to say sepsis, but anyway, we can Google it later. So maybe it was a case of sepsis, an infection that got so bad, and that moved the sugars, to levels that could not be tolerated. The child was on insulin, of course, and then I saw them up to about age 1, and they disappeared. So transient diabetes can go all the way up to 2 years, right? So they disappeared. So I really may not know what became of them, if they became fully diabetic or it just disappeared.
Right.
But yeah, that was the youngest.
That's the youngest.
I've seen. Yes.
That's the youngest.
Yeah.
I hope
of course, then
right.
we have parents coming with 10 days old children, born full term, and they have diabetes. And of course, the parents will be more sick. It is a challenging situation, and they will be crying.
Did you say 10 days?
Yes, 10 days
no,
old.
I'm thinking at that time,
parents.
that would make anybody panic. At 10 days, how do you even tell this child is thirsty, or how do you even tell
No,
at
the
10
child
days?
is very, very sick. They are running fevers.
Wow.
You are testing for malaria and infections and everything else, and there's nothing. And you just pick the sugar. And that's why we are saying, go to the experts. If you went to a general doctor, they wouldn't be able to pick that. That's not what they're looking out for. If you went to a pediatrician, they would be able to pick that. And then if you're lucky and you ended up with a pediatric endocrinologist, they would even know it immediately.
Right.
Or maybe at that point the sugars have been so high, and that smelly, fruity breath that we talked about.
Yeah, you're able to pick up
you're
that.
able to pick that up, and they'll know right away this is sugar. Or maybe the child fell into diabetes ketoacidosis, and now it's an emergency case, you're rushing them to ICU. Then they'll be able to pick that. So it's a lot of, expert advice and, having that extra eye to look through and find out what happens. But, well, if we come back and we're talking about management of diabetes in children.
Let's focus on that now.
Most of our children have actually been managed as adults.
What do you mean by that?
They've been managed as type 2 diabetics. They've been told, you know what, you're diabetic, you cannot now eat your meat because we don't want you to eat. You can only eat 1 egg in I don't know how long.
How about we go back to how do you then break the news to a child? A child you can have a conversation with. How do you break it to them that, Baba, Mama, you have this? How do you even explain diabetes to a child and what is going to be different from today?
So it depends with the age of the child. If it's a very young child, like we say 2 years, the parents need to know, but you also have to explain to the child why you have to keep poking them.
How do you introduce the poking to them?
Yeah, so you tell them, okay, I want to find out, you're sick, you're not feeling well, you're uncomfortable, maybe they were running fevers, or, the sugars are so high, they're not able to play, they're always fatigued. And you tell them, we want to deal with that, we want to help you not feel fatigued, we want to help you play with your friends. And so we will prick here, then we will put it on this machine, usually it is a glucometer, and then what reading we see will help us to know if you're doing very well. So it is step by step, it's in bits, age appropriate. And that's why in the management of diabetes, what we call a multidisciplinary team approach, it's not the doctor being the psychologist, being the counselor,
playing all the roles.
No. You have somebody who will talk to the child about play, because we're talking about physical activity. You're not going to send a 2-year-old to the gym. No. So physical activity, how do they play? You're also not going to tell the child, sit down, you're diabetic, you're never going to play.
No.
So you're going to explain that. Somebody else will be able to do that. A counselor will be able to even sit with the parents and help them come to terms with the fact that they have a child who's diabetic. And what are the few changes that they need to have in the house? If we're talking about sugar, we're not going to buy sugar for everyone, not just the child who has diabetes. We also need to have a nutritionist in place. What are the things we're going to change in the household? So this is point to point, step by step. You're going to have a diabetes educator, somebody who's going to tell them, break it down. What is diabetes? in a language that a child understands. You're lacking energy because your energy is not going where it is needed. Even if you have to draw, I personally, when I see my patients, whether adult or young, I work with my pen. We draw. Whether you're going to use cartoons, there are publications that you can use, to
explain
play
to a child.
Yeah, so that they understand really what's
Yeah,
happening.
that visual always helps.
If it's a teenager, for example, they're dealing with all this. It's puberty, and then there is diabetes. Where do I do this? You have to know at what point they're coming from. You're not going to just dump the insulin onto them and say, here. You
From
don't
today,
inject,
you will
you're
need
going
to
die.
3 times a day.
If
you don't inject,
you're going to die. They will not listen to you.
The other question I wanted to ask you, it related to that. Is there anything that we eat that then spikes our sugar? Are there any foods we need to watch out for? Now you've mentioned the correlation could be minimal, but your expert take on that.
Yeah, because we simply need to look at where does the sugar come from, okay? Especially when you're talking about food. There are other things that will give you sugar. Your liver might give you sugar when you have not eaten, the glycogen breakdown. But let's talk about food. Let's narrow it down to food. So any food that is a carbohydrate, the end product after digestion will be glucose. That's the same glucose we're testing here. So it is not, let's not confuse glucose in our body with sugar. Because most people will say, my child is diabetic, they're not going to take sugar, but they'll take honey. What is the end product of breaking down honey?
Sugar.
It is sugar. It is glucose. That's the same thing we're testing. You're not going to say, my child is going to eat brown ugali today because they're diabetic, and that's fine, they can eat all they want. What is the end product of breaking down that brown ugali? It's flour. It's a carbohydrate.
Same sugar,
it's
glucose.
Sugar. Yeah? So yes, there is something we call glycemic index. How fast does a food become sugar in your body? That's another consideration to make. That's why you will find somebody telling you, overripe fruits are not really advisable for you as a diabetic because it will shoot your sugar really high.
Interesting.
As opposed to fruits which are ripe but not extremely ripe. Or then you want to compare fruits like berries or apples with something like a mango. The mango will have a higher glycemic index, so it will shoot your sugar higher much faster than your berries, okay, or than your apple. Then we're also thinking about what is the fiber content of the food that you're eating. The more fiber a food has got, the much slower it will be converted into glucose over a long period of time. Meaning just a small amount, it's able to satisfy you for a very long time and to make you have a smooth curve of your blood sugar going up, instead of your juice spiking
up and down. So let me get you correctly. Either way, there are certain foods that then would make your diabetes worse that you need to stay away from or have minimal intake of them.
Minimal intake would be the right
word.
Okay. Minimal intake.
Okay.
So it is not a no-no. Remember, we're dealing with children.
Yeah.
Are you going to tell a child you can eat that fruit?
You can't have, like you said, you can't have cake on your birthday.
Exactly. So you probably want to just slice it, and all of us share it, and that's all that there was. So when we are done, we are done. So the impact on your blood glucose will be very little.
Okay.
But all said and done, remember, all carbohydrates will be converted into sugar.
If there's any parent who wants to connect with you, how can they connect with you?
So if there's any parent who needs to seek my services, I consult at Mpisha Diabetes Center and also private clinic at diabetes at the Doctors Plaza Nairobi Hospital. And you can check me out. My name's Betty Okere on Facebook. And I think that's the only social media handle I've been able to handle. So you can check me out there and we'll surely get you an appointment. But if you want to call, then you can use the mobile number 0798 213 363 and then you book an appointment.
Thank you, Betty.
Asante sana.
Always a pleasure to have you.
My pleasure too.
And with that, we come to the end of today's episode of Today's Parent, where we were talking about diabetes in children. If you have any other questions you want to ask Betty, please reach out and send us an SMS. I have been your host, Christine Kasina. We have been here in studio at Little Cribs, the home of fun, exciting, and durable kids furniture. If you're looking for parenting information, go to www.supermamas.co.ke. We look forward to having you next time. Please stay tuned.